Welcome friends to CNS Viewpoint. Just like every day, today again at 5 p.m. India time, we are back with our thoughts and views and perspectives on something that made us think. So friends, today we are going to talk about a news which made me think, and that news, the headline was something like, 13 districts in Uttar Pradesh have more women going for COVID vaccination than men. So more women are getting vaccinated than men. In 13 districts of Uttar Pradesh. And if you read the tone of that news, it is very self-congratulatory from the government side. And, but the point here is, how many districts are there in Uttar Pradesh? There are 75 districts in Uttar Pradesh. So out of 75 in 13, we have more female than male who have been administered the COVID vaccine. But in 62 districts, we have more males getting vaccinated for COVID than females in those districts. So on one hand, so what is the news? Is the news 62 out of 75 districts have more males in Uttar Pradesh getting vaccinated than females? Or is the news that in 13 districts we have more females getting vaccinated than males? The truth is, the bottom line is that the real goal of every government on the planet Earth should be to fully vaccinate every eligible person, regardless of gender, caste, creed, color, etc. Everyone who is eligible should get a vaccine. It's almost 10-11 months, and Uttar Pradesh state has not been able to vaccinate, all its eligible population. Rather, it is way behind if you compare it with the national average in India, or performance of other states like Kerala, for example, where more than half of the population is fully vaccinated. Himachal Pradesh, Sikkim, etc. Rather, Uttar Pradesh will come towards the very bottom if you tabulate all the states in the country as per government's own available data. So we need to be, I think, really move out of this self-congratulatory and grandiose kind of dishing out such kind of news which make us look good, but also distract the people by and large from main issue. The main issues is gender inequality. The main issues is how, because of gender-based discrimination, gender-based stereotypes, women and other gender sexual minorities are left behind or in accessing existing care and services and face undue discrimination, stigma, harassment, abuse, and this also goes very true for health. So if you look at any other health service, you will find gender-based discrimination and gender-based barriers are there, whether it is tuberculosis, it is HIV, the way the problems which women face or other LGBTQIAP+ communities face in accessing care services or with dignity are often ignored, mostly on blind spot. And so going ahead with just this data that more males than females or more females than male are getting vaccinated, etc., is a very misleading and very less representative and far away from reality kind of a news. So there was also a news few days back that 4 days back that 70% of healthcare workers who are administering the COVID vaccine are females. So what do you think, who is administering other health services? Whether it is routine immunization, it is maternal and child health care, whether it is non-communicable disease care, or it is tuberculosis or HIV or any other care, you will find it is more women than men, more females than males who are shouldering the responsibility of being care providers. And it is of course more women than men who are not given their due right, privileges, entitlements, and other perks and other which is rightfully their very due, because they are the care providers. So friends, we just wanted to say this, that this is not news. This is again taking credit for something which is already there and not addressing the labor rights, labor laws which are absent for so many community health workers, or seldom addressed for so many community health workers which are female, which are essentially female. Even by legislation in several countries, community health volunteers are females. So and not paid, and often not covered by labor laws and labor rights which exist in the same national policy framework. So with these words and with these thoughts, I will end today's CNS Viewpoint, and tomorrow again at 5 p.m. India time, just like every day, we will be back again with our thoughts and views and perspectives on something that made us think. Bye till then, and more soon tomorrow and every day at 5 p.m. India time. Bye bye.